Did you know that blood pressure also affects the blood itself? So yeah, it is that
It's called
bad.
high blood pressure.
Exactly. So
clearly blood is affected.
Yeah, I get the logic.
Hey, from the word itself, blood has
This is
to
the
be
mama
affected.
logic. There are doctors out there, midwives. This is the mama logic. So yes, the blood is affected. Okay, your blood is supposed to renew itself ideally every like 3 months. It renews. Etc.
Okay.
Now, obanga olina pressure, ogw'omusaayi ogutandika okwemenyaamenya. I don't know how to call it. It breaks down. Okay. When it breaks down, there are components in your body that help you. Nti wemba nkusaze wanuwa omusaayi gukala mangu. Kati gwalina pressure tegukala mangu. Otandika okuyiika omusaayi oyika buyisi. Exactly, you keep oozing. Because ojjukira protein etwogeddeko ezagenze zigenda n'ebyo ebintu zigenda n'ebyo ebiyambako clottinga and also the liver helps us actually make those proteins that help us clot. If the liver is affected, kidney is affected, kati osigazzaki
blood will
zero.
also be affected.
Now this is where it even gets more fatal. We don't want a woman to reach there.
Yeah.
Wobanga oli lubuto, you have gotten high blood pressures like this. Or your doctor has diagnosed it. Everything was okay by the way, you had no sign. Some women have no sign.
Some women have no signs by the way.
Nobeerawo nozala omwana wo bulungi 1 week after you've given birth magamba pressure zikola ki zirinnye. Oba ne bakwana okuleeta ng'ogamba naye omutwe gagunnuma ne bagamba nenda naye olina stress omwana twagala mwana wo biki pressure zikola ki zarinnye. Sometimes it can happen after birth, sometimes it can happen. You mentioned something about high blood pressures with you, was it?
Yeah, it was after
birth.
But then I also, now that I look back, I think I did, complain about the headaches a lot.
Yeah.
But then also I realized that at some point my baby failed to latch, so he got dehydrated and they took him to the nursery. You guys, that messed with my head.
It messed with your head.
I could not understand after that. Like I didn't know what was happening in my life.
Because you had a baby. So
now the pressure went
going up. Kale, I'm glad you brought it up because most people assume know, like you know, nti wembeera stressed pressure zigenda kulinnya. Guys, if you're stressed, pressure egenda kulinnya emali ekole ki? Okay. If your pressure keeps on rising, kiba kitegeeza you have high blood pressure.
Yeah.
Now, that high blood pressure can occur. You have no symptom. You have no what. It can also happen. If it is diagnosed, it can be diagnosed by the way before you're even pregnant. Now, what is high blood pressure? So now we can get into the figures.
Now we can understand.
Pressure pressure tujiwandiika figures wabere eya waggulu
eya
wansi
mulimu kadashi makati
olumu kabeera bwe kati olala kabeera bwe kati kati eya waggulu if it is 140 n'okusukkawo ebeera mbi
140 n'okweyongera waggulu
ebeera mbi eya wansi
slash wansi
eya wansi
namba eya wansi
webanga eri 90 n'okugenda waggulu ebeera ki
mbi.
So anything above that obanze nyinako 141 over 90 ekiki
newe 140
exactly. If it's 140 90 it is bad.
Yes.
If it is 150 200 hey Jesus
tugenda kubakawo basi
exactly. They arrest you in the hospital and then you say bana bansibidde mukola ki mudwaliro tebakusibidde mubagenda kujjanjaba. So it can actually get that high without any symptom for some women.
Yes.
Waliwo omuntu agenda okujja nga azze for the first visit n'amupima pressure ziri waggulu. Now weziba ziri waggulu tunala kuweza myezi 5 egy'olubuto awo tugamba nti walina pressure ng'olubuto terunakola ki kujja. So possibly you've been living with your high blood pressure nga tokimanyi.
Just olubuto lukiyambyeko to be more pronounced.
Not even that. It means the pregnancy at that point has no effect. The pregnancy starts showing effect after you have 5 months onwards. That's when otugamba nti eno pressure yagira ku lubuto. And if it is like that, it means that for you ovudde ku ddagala even if you've delivered like this, you need to continue that medicine.
You need to continue.
Now, why on pressure enegira ku lubuto yetwogeddeko. You've stand 20 weeks nekola ki nejja.
Neyingirawo nga gangasta.
Very good. That's why we call that pressure y'oku lubuto. In English or in medical term we call it gestational or pregnancy induced pressure. High blood pressure.
Gestational.
Exactly, gestational. Now waliwo ejja ng'omaze iwe postpartum. Okay? Postpartum. Kati no when to okuyisa that those proteins in your urine. That is when preeclampsia starts. Now preeclampsia is now a manifestation of things that can go wrong everywhere and that we've talked about.
So preeclampsia is
protein.
When you're pregnant.
You have high blood pressure.
You have high blood pressure.
And any of the symptoms, any of the signs is called preeclampsia. Okay? And also in the blood, by the way, I forgot to tell you, there's something called platelets. They also help with clotting.
Nazo when it's broken down,
very
it
good.
can no longer clot.
You are very good.
I don't even know.
If every mother was
People,
like you should
meet me after.
You should be my next client.
Thank you, ma.
Very soon.
Thank you, ma.
Okay, so now all those things, if you have any of those symptoms, that's why you do also a CBC in pregnancy, for blood count. So kukebera nsibanga HB omusayi guwera gokanenda tukeberako nako, how are the platelets? In case they're getting lower and lower, is a problem. Now, bamaze okupima bakubuliddeko nti pressure ekola ki mweri. Kati gwe tokyali mukyala y'omu owa antenatal wa bulijjo. Your antenatal now changes.
It becomes different.
If your doctor or midwife tells you komawo mu mwezi ogumu gaana, do it every 2 weeks. If your blood pressure now for you is even like in the 200, actually no, 160 over 100, be admitted. Literally. If you can't be admitted, come every week. If you can do every day, measure your blood pressure every day. And swallow those medicines. Pressure yebegani okuka, usually trying to kuba eddagala erisooka ntulaba oba eddagala liganya kola ki kuyamako ku pressure. Weba liganya okusa pressure. That's why I want you to measure your blood pressure every day. Tuberenga tulaba eddagala likoze oba tukyuseemu oba tuwongereko eddala. Wala omukyala asobola okutuuka nga you're like on 3 medicines for high blood pressures. Others might even be on 4 because you're trying to bring it down. Now the goal of bringing it down is not because it goes away when we bring it down. It is because we don't want you to reach the other level of the complication of the eclampsia. Hey, this girl, very good. Okay? Itwagala wires sorting mutwe. Eclampsia. Itwagala tutuke yeyo. Now, does that mean that chijjawo obuzibu? There's a mother who asked on the TikTok page, and they said, mine is 151, I think 80. Should I be worried? Yes, you should be worried.
If any of the two are different from the variations Musawo has
exactly
said, if the one of above is 130, but the one below is 90, there is cause for alarm.
Yes.
If the one above is 140, and the one below is 82, there's still cause for alarm.
Exactly.
Yeah.
Now, when we give you medicines, actually your pressure, what we are now studying in medicine is that it's something to do with the pregnancy.
Okay.
Placenta we talked about the last time. Yes. It produces some things that go into your body and make your body react. So whereas the baby is also trying to hide from you and not be pregnant and cause all those hormones to do that, it can also now lead you to have high blood pressures. And that is why you see pressure weziba ziganye tugamba ki. We stop the pregnancy. That is the only. That's one of the instances in Uganda where you are allowed to terminate a pregnancy. So bakugamba nti yes, we are going to stop the pregnancy, not because the baby is bad. It is because you are dying. Because when your organs fail, it means you are on the road to death. Okay, so we stop the pregnancy to make sure that you are alive because you can have another baby. It is a shallow decision has to be made like very quick and very direct. That means obali ku myezi ejo kumpi okuzaala, you can have a preterm. And then they cancel and tell you baby wanazalibwa nagenda mu ICU y'abaana NICU oba special care unit bajanjabira ki abaana. Nebambi if your baby is below 26 weeks olinga myezi 4 myezi 5 myezi 3, we have to stop that pregnancy. Because in Uganda, the survival rate of babies who are like 4 months is really low.
It's really low.
Okay, 5 months is really low. So we stop the pregnancy. And then, we go through the counseling and all that. That is when we can stop it.
Thank you. You mentioned the point of counseling. And I think what I see also here is it's very important in the event that you find out your pressure is getting high, that you start going with your partner.
Exactly.
It can be very tricky when Musawo you're telling a mother,
and then the husband
we are going to have to end
idea.
this pregnancy, and the husband is not there. There will be a misunderstanding that maybe she just wanted to terminate it.
Exactly.
Or there will be like misconceptions around it.
And that is why men should come
it's
for
important,
for sure.
Thank you.
Yeah.
That men should escort their wives for these antenatal visits. There's so much that can happen
and they
there.
should also get involved. Wabakomyewo kale fine, maybe they were at work or what. Naye wabakomyewo mubuuzeeko nti bakebeddeko ki leero bagambyeko ki.
What did they find?
Yes. Naye tomubuuza bw'otyo. Women have pregnancy brain, you people. It is real. Women forget. Nobody can from antenatal clinic. But now that the men sometimes get impatient. They're like, omukyala wamnyonyodde tabitegedde. nedda yabitegedde
yabitegedde nga babinnyonnyola.
That is why we need you now. Jangu buddwayo nawe otuyambeko okujjukira. If you don't have a partner, it's well. Jangu with your best friend. Come with someone you're comfortable
come
with.
Come with a sister. Come with an auntie.
Someone you're comfortable with.
Agenda okubeera your caretaker should be someone that you're comfortable with.
Exactly. Abantu abasinga baplanning caretaker only after they've given birth. Why when a caretaker what neto?
By the way, speak on it. Chogereko.
Tujja kugenda yo birth preparedness later. Okay.
That nkaisa wisa. I also thought the caretaker is only important after. Nachikubanga bwomu. Antenatal. Ash. Kumulimu swi
never kono yo muntu artista akujjukizaako content naye nsawo yagamye okole bot ne boti.
But also it's important that nachambade ngamba chiri nti if you're getting such news it hits different when you're by yourself. There's so much.
Exactly, there are very many questions.
Too much information.
Sometimes like when you even tell a mother we're going to like admit you now, you can't go home. Atabuka.
You get disoriented.
Ate kati abaana nino bachuma kusomero ate kati nino kola ki ate nduka lessons gule ate chi. Yes, you have to stay in hospital because sometimes it's a life of matter and death. And you know when we tell mothers this, it's not to scare them. It is to tell you because we see mothers dying.
Yeah.
So when you tell you we're going inside the hospital now, it is our right to keep you in hospital and keep you alive. Yes, you're thinking about all the things. That's why preparedness is important and we shall reach there. But at that point, Bambi, sigala mudwalido, bakujanjabe. At least ask, can I be here and abeba sonokuka in the next few gundi ntiye. Newa wabakugama ntensigo zigenze ebibumba. Call someone else again akuyambeko because that means you have to be in hospital. And better sometimes we even have to like, if baby is there, the important part we haven't talked about it is the baby and how pressure affects the baby. So whereas the baby brings the problems as well with their placenta, it can also affect family like a baby. Now that placenta also has blood vessels, remember.
Yes.
But if the pressure also affects those blood vessels.
If the blood is affected in me, it is most certainly going to go through the placenta.
And then also affect the baby. But now kati ya baby yo, kubanga pressure na yo kale ekendeze misuwa the so if it's like this ekugenda nekola kinekola webati negufuka ka small so that means nti jukira placenta yetwali ya baby ekyokulya n'ekyokunywa n'ekyokussa at if the blood vessels are small what happens baby abafuna katono and that's why you find many women with high blood pressures have very tiny babies. The baby is struggling to survive.
That is if they
and their babies are more likely to what? To die. They stop moving. Or they reduce their movements because they are struggling. Yes.
Ask, is the baby still moving?
Exactly. So is your baby moving?
Sitano.
We expect a baby should kick at least over 10 kicks in a day. Over 10. Yes.
Hospital.
Sweetheart, that is the pressure affecting your baby. If your baby is still alive, discuss with the gynae. If you're not comfortable where you are, if you've been maybe like in a health center 2, health center 3, you're discussing with a midwife, or maybe any clinic, you're discussing with a midwife, then you're allowed to take duka.
You know,
you're allowed to have
high blood pressure is sensitive in pregnancy.
Very sensitive, and for everyone, both mommy and baby.
What is sad is that many mothers do not see or understand the gravity of high blood pressure until they get there.
Until you get there, and most times that's if they even live to know that they got there. That part where you get there, tokomanga like we know again that dollar.
So Katimuso, my question here is for a mother that has lost 1 pregnancy, 2 pregnancy, 3 pregnancies because of high blood pressure.
Okay.
How do they move on? What can they do? Because they are there. A mother has lost 2 babies and they're even afraid now to even start thinking, can I have another baby? You understand?
I know.
That fear. And again, to these mothers and to the partners, you need counseling. Some of these things you can't carry them on your own.
I am here reading the messages. There's over 10 messages of mothers who have lost babies in this chat. Now, if you're a mom and you've never made it above 7 months and your babies always die, one is attend antenatal. Actually, it's called prenatal. Before you get pregnant, come to us.
The prenatal.
Yes.
It's important.
Because what happens that if your blood pressure is not controlled well before you get pregnant, it worsens with the pregnancy. So Jangu, we have that prenatal chart.
Okay.
We make sure your blood pressures are normal. We make sure you're on the right medicines for pregnancy. Then after that, when we make sure, okay, fine, your blood pressures are now normal, now we can start the pregnancy journey. When you start the pregnancy journey, kati gwe obanga antenatal yo teri nga ya buli omu. You're not the person going to wait for simanga nti
one month, the same date next
for
month.
you, if you can, even every week. And women always say it is expensive to go for antenatal. There are health centers across the country that are free, guys.
You know why they think it's expensive? Do you know why they think it's expensive?
Consultation, auntie.
They want to go to the one in Kampala.
Oh, you're in Kampala.
Yes. I stay in Wakiso, but the one I want to go to
is in Kampala.
Golobi.
Please, people, it is
go
okay
to a nearest health center.
If you can't afford to wake up every morning at least and go to that nearest health center, omanye high blood pressure yo, worried until your doctor is fine in Kampala or is in Wakiso, you're working in Mukone, you're working in Jinja, get a book. These days even have apps. Note down my blood pressure diary. Today is this, today it is this. Obede, very good. Obedenga tujajiro wozake. Obedenga osindikira doctor wo. Make that agreement with your doctor. Walabanga, something is off. And even the mother herself says, this one is high. Otherwise, if you give it the time of like, let me come back in the next 2 months, in the next 1 month,
so for that mother who has had an issue with pressure, and your babies have not made it beyond 7 months, do antenatal on a weekly.
Exactly, on a weekly if you
can. Religiously.
If you can't, at least 2 weeks. Actually, just do it every 2 weeks. Religious antenatal every 2 weeks. Now, after that, if you have done those religious antenatals, etc. na yochiganye. Right now in Uganda, there's something that we call surrogacy. There's something that we call IVF, okay? That is assisted reproduction.
But with IVF, doesn't the pressure still affect it?
Now this is it. We are trying to get now the pregnancy away from you so that someone can carry it for you.
So IVF, you get the
so you get a surrogate. The ingredients, a G and a sperm. Then you check out muchalo mlana na kukwatira ku mwana. It's not because you are a lazy mom, it's not because you are a lazy woman, it's not because you failed God. It's because we want you to be alive, at least for your baby. Those options are now available. Edanga tezabeedanga wo. But now they are
but it's a
available.
Journey to get them. So
it is a journey.
It's a journey to accept.
You know, it is a journey, yes. The two are journeys. One is a very sad journey.
Yeah.
One is a journey with a lot of questions, but some little hope.
Yeah.
That you're more likely to actually have a successful pregnancy.
Yeah.
Sometimes it's not because you annoyed God or bakuloga. Ate basenga bagamba nti pressure kuluto bakola ki? Bakuloga. Walinye ettalo, wakola batya, wagwe ensimbu. Bakuloga. Watakwagaliza. Bambi waliwo bibigana. Era woba osobola bambi. You can have a discussion with the doctor. The good thing is that if you're still young and you still have your eggs, very good. They can use your own eggs and your own sperm. Now, if you're a mom and for you always having recurrent losses of the baby after 7 months, why I keep on saying 7 months is because in Uganda, we consider about 26, 28 weeks to be viability. Viability means a baby can survive nga avuddeyo. Waliwo abamu nga ali 25 weeks, but surviving in Uganda. So we are improving our care. That is good.
That's good. We are making progress.
We're making progress.
Yeah.
Is survival that high? The answer is no. But at least there is something.
There is hope.
Exactly. But if you're in the UK, I think in the US, it's about 21, 22 weeks. There's also a higher chance of survival then. But in Uganda, 26 weeks awo. Fugamantikale, we may.
We can try.
We can try, okay? Now, when your baby is above that time, above 26 weeks currently in Uganda, we can say, fine, we can try to collect. Tukubeza-bezawo omwana. That's why now we now start saying, tani wakwetegereza movement z'omwana, ziri zitya, tozirinda kubula, make sure your blood pressure is done every day and have your antenatal at least every week. When you reach 26 weeks, see, from 2 weeks, can you now do it every week?
Every week.
Waone scan zebakola sikola because scan zebakola okulaba nti omusaayi ogutuuke wa baby gumala bulungi. Bambi sometimes you may find for you you're doing okay with your blood pressure medicines, that the baby is not doing okay. And that baby needs to come out early. Yeah.
Because for you may get the assistance from the medication, but the baby is not picking up on the same.
Exactly, the baby is not.
They're still getting the spoiled blood, the whatever.
They're still not getting enough.
Not getting enough nutrients.
Exactly.
So maybe another question that I can have in that area. Sorry, I'm asking very many questions because it's a personal one for me.
It is well, yeah.
Where say you've lost your first baby, second baby, before hitting the 7-month mark. And then maybe you lose another one after hitting the 7-month mark. My question is there a possibility or is there a way we can maybe perform a C-section on this mother who has made it to 8 months and the baby is still okay?
The answer is yes.
Okay.
And usually there are cesarean sections. The answer is if your baby is stressed on the inside, they can't make it through labor. Labor is umanyo kudika misinde wayo do 100-meter run.
Yeah, I used to be a sprinter.
Kali.
I do sprint.
Tugende wa Kiprotich.
Sikola marathon.
Kiprotich akola marathon
Kiprotich
akola. You do marathon.
No, me I do
Very
sprints.
good. Now baby's going through a marathon during labor. So if you're tired before the marathon starts, it means you can't reach the end.
Yeah.
That's why some babies can die during labor.
Oh yeah.
Yeah. Sometimes babies can die before even labor starts. I've shown you everything. I've shown you. Some babies may start from kicking too much. After they start reducing, the next thing is, the woman comes and tells you, doctor, the baby last kicked last week. Now you know. If your baby's movements change, don't wait for them to disappear. Now you
know.
Jangu. So if your baby at least 7-8 months, usually it's a cesarean section because the baby can't make it. Even the heart of the baby beats slowly. Like it's bad. It's very bad.
Because now I was thinking for such a person, telling them to wait or to manage until the 9th month when they've probably lost a baby at 7 months, at 8 months, may be hard for them
to get there.
To have the hope.
So we don't just get out babies also. We only get out a baby if they're only above 37 weeks. However, Tugambi, if pressure is now affecting your baby and also affecting you, there's an organ is dying somewhere. You're 28, 29, whether you're 16 years.
Specifically young mothers.
Exactly. All of you have risks. The ones who have the highest risks of getting a high blood pressure, like you can see in the chat of that TikTok, many of them were saying, I had twins. So yes, twins actually increase your risk for high blood pressures. Yeah, they do. They don't know more pregnancies. Abala batera okufuna pressure oba oyina emyaka once 18 and below, you are at a very high risk for high blood pressures.
Children stay in school.
Musome bitabu.
Disengage.
Please, and also men out there. Do not men out there should not interfere with our
younger
girls.
men, older men.
Leave
children alone.
Exactly.
Let the young children study.
Exactly. The other people is if you're 35 years and above. However, but we're now saying any age right now. Yeah?
As long as it's pregnancy.
Exactly, as long as it's pregnancy.
Be
watch
cautious.
out. Yeah. If you have ever had high blood pressures before, whatever inner pressure, you need to also know that you have the risks that are going to come in.
And specifically for me, my take home has been for a mother that has had pressure before. You have lost, unfortunately, a baby before to pressure. Please go for prenatal care.
Exactly.
Please
go for prenatal care. Attend your antenatal care religiously. Attend your postnatal care religiously because high blood pressures can also occur after you've given birth. So high blood pressures are dangerous for all of us. You don't want you to wake up in the morning and you have a stroke out of the blue. So come have your high blood pressure. Your blood pressure is taken to make sure that high blood pressure is not a problem in the home. Make sure you attend your antenatal, your postnatal, and your prenatal care as well is very important. And as we close off, Ngatumalidiza.
Yeah, boss.
Do not forget to tell us in the comment section at Treasure Hand Uganda, at Dr. Ruth Grace. Tell us, guys, what are your concerns that you want to know that we can discuss more about in our podcasts? This is the only sexual reproductive health podcast in Uganda. Mutuulira. So stay tuned for the next episodes. Let us know what we should tell you, what we should inform you about, and we shall be glad to have you. Lero kachai kabaddewo tweyanza ba sponsor.
Thank you very much.
The cameraman behind the camera.
Peace.
Thank you very much. That was beautiful.
Thank you, Doctor. That was beautiful.
Good. Yeah.